Welcome guys again to another lecture in respiratory system, which is about the larynx. So let me give you guys a brief introduction about the larynx as an organ that's located in the midline, and it's merely a passageway or an airway, let us say, to conduct the air from the nose all the way down to the lungs, and it also has a vocal cords. That means it's responsible for voice production. So it's an airway, and it's responsible for voice production. It's located in the midline, as I mentioned, just inferior to the hyoid bone. If say this is the hyoid bone here, so it's just inferior to hyoid bone. It extends. If we talked about like surface anatomy, it's referred to the level of, or extends from the level of C4, cervical vertebra number 4, to the, this is the cricoid process. Okay, this is the end of the larynx. So the larynx extended from C4 up to C6, cervical vertebra number 6. So again, it's responsible for voice production because it contains vocal cords, and it's about 5 centimeters or 2 inches. Where is it? Here is, guys, the epiglottis. What you see here is the epiglottis, the thyroid cartilage, cricoid, and so forth. We'll talk about it. So it's about 5 centimeters. It opens superiorly and inferiorly, or let's say it opens above and below. Before say where it opens superiorly or above, let me remind you with the pharynx that has 3 parts. One part behind the nasal cavity, and the part of the pharynx behind the nasal cavity called nasopharynx, and the part of the pharynx behind the oral cavity, we call it oropharynx, and the part of the nasal cavity behind the laryngeal inlet, we call it laryngopharynx. That means the larynx opens superiorly into laryngopharynx, but below it opens into or continue with the trachea. So in general, what comes to your mind when you know that there is an organ called the larynx, and indeed is responsible for conducting the air and producing voice? Well, simply the larynx consists of like cartilages, and these cartilages, guys, like for example thyroid cartilage, cricoid cartilage, and so forth, these cartilages are stabilized by membranes and ligaments, plus the larynx itself, and the movements of these cartilages and other structures controlled by the muscles. Muscles can be external, extrinsic muscles, or intrinsic muscles. And of course, all of these structures should be covered and lined by mucosa. Mucosal, that means mucosal lining. Okay, here is again, let us start with the cartilages. So this is the, what you see is anterior view, anterior view to the larynx here, and this is a posterior view of the larynx. Simply the larynx consists of 9 cartilages. 3 are single and 3 are paired. Well, interestingly here, guys, that all of the laryngeal cartilages except the epiglottis are made of hyaline cartilage. That means all the thyroid, all the cartilages or laryngeal cartilages are made of hyaline cartilage, except the epiglottis that made of elastic cartilage, because you need a cartilage to move up and down and close the cap or the laryngeal, or participate in the closure of the laryngeal inlet. That's why the epiglottis made of elastic cartilage. So here is what you see here again. So we have 3 single cartilages and we have 3 pairs of small cartilages. The 3 single cartilages are thyroid cartilage, cricoid cartilage, and epiglottis, while the 3 pairs of small cartilage, or the paired cartilages, are, you have 2 arytenoid cartilages, articulate superiorly with corniculate cartilages, and still you have two small cartilages here anteriorly, not shown in the figure I will show you, called what we call cuneiform cartilages. So you have two arytenoid, two corniculate, two cuneiform cartilages. Mainly those form the posterior lateral border of the laryngeal inlet. Okay, let's start with the thyroid cartilage. When you, if you look back again here, look at the close relation of the thyroid gland to the thyroid cartilage. That's why here is the, what we call it, the thyroid cartilage. Here's the thyroid cartilage, guys, and it consists of two laminae. You have right lamina here, where you see, and left lamina, both laminae, but not completely, just the lower 2/3 of the both laminae, they fused anteriorly to form laryngeal prominence. So this prominence, called laryngeal prominence, made by the lower 2/3, or the results from the fusion of the lower 2/3 of the two laminae, the right and left. So this is the laryngeal prominence. And the laryngeal prominence, guys, it's prominent in male as the angle about, let us say, 90 degrees in the male, while in the female the angle is more than that. It can reach up to 120. That's why it's not prominent in female. That's why the laryngeal prominence, this prominence called Adam's apple. Adam's, male. Adam's apple. However, superiorly, once you see here, guys, the just above the laryngeal prominence, you have a notch here called superior thyroid notch, which is prominent. And the superior thyroid notch plus the laryngeal prominence are very important palpable landmarks in the neck, right? Easily to palpate both of them. It's not just you have superior thyroid notch, you have also a small shallow inferior thyroid notch, right? Okay, let me erase those, guys, and here back again. So this is the thyroid cartilage, and this is the two laminae. This is laryngeal prominence. This is superior thyroid notch, inferior thyroid notch. Now the laminae posteriorly, they extend up and down to form the superior horn and inferior horn. Look at the inferior horn. On the medial surface of inferior horns, there are facets. This, for example, this facet for the articulation with the cricoid cartilage below it, right? Okay. Now also, again, we need to raise it here. Look at this line. There is a prominent ridge here called oblique line, which is started from the base of the superior horn and extended down toward the inferior border of the lamina. And this oblique line has a tubercle inferiorly and superiorly. So you have thyroid tubercle up and down. Indeed, this oblique line, guys, for attachment of extrinsic muscles, like, for example, the sternothyroid muscle or thyrohyoid muscle, or sometimes here you get the, not sometimes, it's indeed for attachment, not just sternothyroid and thyrohyoid, but also an attachment, the allocation for attachment of inferior constrictor muscle. Inferior constrictor muscle that's related to the pharynx, right? So what else we have? I think almost we are done. Let us move to the second single laryngeal cartilage. Okay, the second one is the cricoid cartilage. If you don't know where is the cricoid, let me show you here again to get like per review. So this is the thyroid cartilage, and just inferior to it you have the cricoid cartilage, which is like a ring. The cricoid cartilage, guys, before moving to the slide, it's the lower end of the larynx. It is the lower end of the larynx. It's a complete ring. Let us have a look here. So it's like a signet ring. You know the signet ring that has like a small ring of metal here, and there is a large stuff there. So this one is called signet ring, sometime written stuff there or whatever. So it's like it has a narrow arch anteriorly and broad lamina posteriorly. That's why it's like a signet ring. So it's a complete ring. So it is while it is at it represents the lower border of larynx, it's at the level of C6, because we said that the larynx extended from the C4 to C6, and this is the lower end of the larynx, so it's at the level of C6, and it articulates. Look at the lamina. The lamina has on its lateral surface has a facet for articulation with the inferior horn of the thyroid cartilage, right? Of the thyroid cartilage, sorry. And one on the right here, you have a facet here, and you have facet on the other side. Those for attachment with the inferior horns of thyroid cartilage. Now, also the lamina has on the superior lateral surface has two facets. These two facets for articulation with the arytenoid cartilage. Let me show you here. Here is the thyroid cartilage with the inferior horn. Look at the inferior horn, how it articulates with the cricoid cartilage on the facet there on the lamina to form cricothyroid joint. Also, look at the cricoid, the facet on the superior lateral surface of lamina, goes for articulation with the arytenoid cartilage. It's like ears, like rabbit's ears, right? So, or let us say giraffe ears, whatever. So these arytenoid cartilage articulate like with cricoid cartilage by this way. What do you see here? Okay. What else? Of course, guys, we mentioned that this is the arch, a small arch. This is the arch of. Let me change it. Okay, this is the arch of cricoid cartilage, and this is the broad lamina here. Posteriorly, if you look to the lamina posteriorly, you will get this view. So this is the posterior surface of the lamina. It has two depressions, one on the right, one on the left, and in between there is a ridge here. This ridge for the attachment of esophagus, because you know it's the cricoid is part of larynx, and behind the larynx there is an esophagus. So it's an attachment for the esophagus, right? Now, what about these depressions? Well, guys, these shallow depressions for the attachment of posterior cricoarytenoid muscles. If you say, you remember the arytenoid cartilage, so there is a muscle here, what we call it posterior cricoarytenoid, between the cricoid and arytenoid, posterior cricoarytenoid muscle. Okay, I think we are almost done with the cricoid cartilage. Let us move to the third single cartilage, which is what we call it epiglottis, or in Arabic lisan al-mizmar. So the epiglottis, guys, is like a leaf-shaped elastic cartilage. That means it's not hyaline cartilage. It's the only thyroid. It's the only laryngeal cartilage that's indeed made of elastic cartilage that gives it like more elasticity and you know, it's easily to move, I mean, which lies behind the root of the tongue. It has a superior rounded border, free rounded border, and it has tapering inferior, let us say, end that attaches to the what we call it, the thyroid lamina, whereas at the fusion of the both laminae, here is superiorly is the attachment of the tapering end of the epiglottis to the thyroid cartilage, and of course attached by a ligament, the ligament between the thyroid and epiglottis, so it's called thyroepiglottic ligament. Thyroepiglottic ligament, this is small one, right? Thyroepiglottic ligament, it's an elastic ligament also. Now let us guys start talking about the paired laryngeal cartilage, and here the first pair, guys, will be the arytenoid cartilage. So these what we call arytenoid cartilages, they are two, pyramidal or triangular in shape. Each one, of course, has a base, apex, two processes, vocal process and muscular process, and it has three surfaces. If let us have a look here. So again, this is the apex, this is the base, guys. These two processes, anteriorly vocal process, posterolaterally, mainly laterally the muscular process. It has anterolateral surface. It has medial surface from here, or it is a medial surface also because they are two cartilages beside each other. And you have a posterior, so we said medial, anterolateral, and the posterior surface. There is also the posterior surface. Okay? Okay. Now, let us talk more about that. The anterolateral surface that you see here has two depressions, one above and one below, and in between there is a ridge here. Okay, the upper depression here for attachment of vestibular ligament that will form the false vocal cord, while the inferior depression here is for attachment of vocalis muscle. But somebody can say, what about the vocal cord? This is a process. It's for attachment of vocal ligament, from its name, vocal process for vocal ligament, and another vocal ligament, so you have the two vocal cords. And posteriorly, you have the muscular process. It's for muscle attachment, mainly the muscular process for attachment of posterior and lateral cricoarytenoid, posterior cricoarytenoid and lateral cricoarytenoid, right? Posterior cricoarytenoid and lateral cricoarytenoid muscle. Now, what else? What do we have else? I think almost we are. Here is the apex, guys, will articulate with corniculate cartilage, if you remember, and the base articulates with the here is the base articulates with the cricoid cartilage, and this is a muscular process for the lateral and posterior cricoarytenoid muscles. Okay. Lastly, here again, guys, you have we finished the thyroid, we finished the cricoid, and we finished the arytenoid cartilage still, and epiglottis. Still we have these two small corniculate cartilages and the cuneiform cartilages. For example, the corniculate cartilages, they are articulate with the apex of arytenoid cartilage, and they give attachment to epiglottic membrane. There is a membrane between epiglottis and arytenoid, so they given like an attachment in there. And the last pair was the cuneiform cartilages. They are embedded in the epiglottic membrane. I will show you after a couple of look at the cuneiform cartilages, and this is the epiglottic membrane, so they are embedded inside it, right? So just like maybe it's been suggested that they strengthening the epiglottic membrane. So guys, that was about the cartilage of the larynx. Now let us now have a look over the membranes and ligaments in the larynx? Well, there is an easy way to study the membranes and ligaments in the larynx. Well, first of all, you see, this is the larynx, right? Here is above the hyoid bone, right? Okay, and below you have the trachea. Let us take the first two membranes or ligaments. I would call them the external ligaments. The first two that I want to talk about are the thyrohyoid membrane and the cricotracheal ligament. Those two ligaments, one up and one down, those stabilize, let us say fix the larynx from above and from below, from above to the hyoid bone, from below to the trachea. So these are the two external ligaments. The first one attached to the upper border of the lamina of the thyroid or laminae of the thyroid cartilage, and to the body and the greater horns of the hyoid bone. So this is a thyrohyoid membrane. So that's laterally, you see here, thyrohyoid membrane. But the thyrohyoid membrane has an opening there and one on the other side. This is an aperture for the internal branch, not external, no, internal branch of superior laryngeal nerve, because the superior laryngeal nerve gives internal laryngeal branch and external laryngeal branch. The internal laryngeal branch with that passes from this aperture in the thyrohyoid membrane laterally, that's accompanied with the superior laryngeal vessels. Okay, the thyrohyoid membrane, guys, thickened anteriorly and posteriorly. Anteriorly, when the membrane thickened, it's still the thyroid, but now it's the median because it's in the midline, median thyroid ligament. While posteriorly, you have not the median or anterior, no, you have a lateral thyroid ligament. So it's a membrane, but once it thickened anteriorly and posteriorly, it becomes ligament. One is the median anteriorly, and the posterior one is the lateral thyroid ligament, in which there is trapezial cartilage embedded there. Although, let me show it to you. Okay, here is the small cartilage called trapezial cartilage. Indeed, this small oval cartilage, clinically, it doesn't have any, let us say, it doesn't have a non-significant function, right? Just, supporting maybe the lateral thyroid ligament. That's fine. So this is the first ligament up. Also, guys, this is again the larynx stabilized below with the trachea. So this is the cricoid cartilage, the lower part of the trachea or lower end of the trachea, in which it connected to the trachea by, so this is the cricoid and this is trachea. This is the cricotracheal ligament. Cricotracheal ligament. Okay, those the external membranes or ligaments, right? So those up and down, let us say above and below the larynx to stabilize to hyoid or to trachea. That's it. Now, you know that the second session now, we have another two, let us say, membranes. But in order to memorize them, guys, let us remember that this organ we call the larynx, it has a function. Yes, it's a passage airway, but at the same time it has a function for voice production. That means there is a vocal ligaments, vocal cords, the true vocal cords, and above them you have false vocal cords. So now let us start then with this membrane, what we call it cricothyroid membrane. It's a membrane between the cricoid cartilage and the thyroid cartilage above, between the cricoid and thyroid. This one is the cricothyroid thyroid membrane, or sometime, or most of the time, not sometime, most of the time they call it conus elasticus. And when you say conus elasticus, you are indicating to the cricothyroid membrane laterally, but the cricothyroid membrane thickened again anteriorly, similar to this, right? But here between the cricoid and thyroid, thickened anteriorly to form median cricothyroid ligament. The membrane now becomes ligament median cricothyroid ligament. This median cricothyroid ligament is very important because in emergency situation, you have the chance to open it because if there is, for example, let us say there is the airway blocked above the vocal cords, there is a blockage here for a reason or another, choking or whatever. So you need to open a hole directly. It's an emergency, just in emergency situation. You can just open it, whatever the sharp stuff you have, and insert like a small tube there to make sure the air gets in the trachea and lungs and save the life of that person. Why it's safe? It's safe because there is just small vessels here, and occasionally, sometimes you get a pyramidal lobe of the thyroid gland, right? Otherwise, it's safe to open it in emergency situation. But back again to the membrane itself, the conus elasticus. The conus elasticus attached over the cricothyroid. It attached to the upper border of the cricoid cartilage. You want to see here, and its upper margin is free. And by this way, the upper margin of this membrane is free. It creates kind of a ligament called vocal ligament. So now we know, guys, that from where the vocal ligaments come. So they are the upper margin of the cricothyroid membrane, or the conus elasticus, right? That's usually sometimes some people guys call it cricovocal membrane, but that's fine. Okay. What else? Okay, that's it. Now we will, in the next membrane, we will talk about the membrane that, you know, it's a quadrangular in shape and its lower margin is free to form another ligament. We'll talk about it. Okay. The second one, you know, before start with the second ligament or membrane, let me show you here what we have in this figure. Guys, this is the larynx, and here is like anteriorly, and this is the thyroid cartilage. It's a sagittal section of the larynx. The larynx divided in the into two halves, right? Okay, this is anteriorly, this is cricoid cartilage, also cut. This is arytenoid, this is epiglottis. Let me show you here the membrane between the cricoid and thyroid. This one, cricothyroid membrane, or we call it conus elasticus, and its upper end form, it's free and form, its upper end forms what we call it vocal ligament or true vocal cord. That was the conus elasticus. But here in this slide, I'm going to talk to you about another membrane. It's a quadrangular in shape. Let me change the color. It's quadrangular in shape. Let us draw it. It has two attached margins, in which one to the epiglottis, posterior surface of epiglottis, and another one to the arytenoid cartilage, and it has two free margins. One, the inferior one, or the lower free margin here, thickened. It's a free, so it thickened to form vestibular ligament, right? Vestibular ligament. That means you have the vocal ligament or vocal ligaments, if you want to talk about both. Vocal comes from the upper free end of conus elasticus, and you have vestibular ligament that has nothing to do with the voice. We call it false vocal cords. Anyway, these are the, what do we call it, the vestibular ligament, formed by the lower three border of the quadrangular membrane, or they call it also epiglottic membrane, because it's between the arytenoid cartilage and epiglottis, between arytenoid epiglottis, epiglottic membrane. And this membrane, it has another upper free border thickened to form epiglottic fold. Epiglottic fold. So back again and again, guys, let me iterate it. This is a quadrangular membrane. It has four corners, and or you can call it epiglottic membrane. It has two attached margins, one to the epiglottis, one to the arytenoid. That's why it's called. And it has two free margins. One is lower, that forms the vestibular ligament, and the upper free border here forms the epiglottic fold. Epiglottic fold. Okay, what else? That's all about the two ligaments, the conus elasticus, what it formed, and epiglottic membrane. Okay, we finish 4 ligaments up to now, guys. The last 2 ligaments are elastic ligaments, and they are just related to the epiglottis. The first one connects the lower part of the anterior surface of epiglottis to the hyoid bone, and it's called hyoepiglottic ligament. Hyoepiglottic ligament. And another ligament we already talked about that connects the lower tapering end of the epiglottis to the thyroid cartilage. We call it thyroepiglottic ligament. Both are elastic ligaments. So these are the 6 ligaments that we have. External 2, and the rest here is, guys, the external 2, the thyrohyoid membrane, and the cricotracheal, while the rest are internal ligaments between the cartilages themselves. One to create the vocal ligament, and it's between the cricoid and thyroid. We call it cricothyroid membrane or conus elasticus. And the second one, which is the epiglottic fold, that forms the lower margin of it, of course, forms the vestibular ligament. And the last 2 were related to epiglottis, and they are hyoepiglottic and thyroepiglottic. Those connect the epiglottis to hyoid bone and thyroid cartilage. So after this, guys, introduction about the larynx, cartilage, and the ligaments stabilizing the mentioned structures, let us get into the larynx. But before getting to the laryngeal cavity, I'll show you the laryngeal inlet, the entrance for larynx. This is the laryngeal inlet, and using the laryngoscope, you will get this view. This is the epiglottis anteriorly. This is the epiglottis anteriorly, right? So the laryngeal inlet, guys, directed upward and backward, and as I mentioned earlier, above it opens into laryngopharynx. But let us see the laryngeal inlet. These are what you see here, circling around the laryngeal inlet, bounded anteriorly by epiglottis, as I showed you, laterally by epiglottic fold. You remember the epiglottic fold? That's attached to arytenoid cartilage and epiglottis. So this is early epiglottic fold. And posteriorly, the laryngeal inlet, guarded posteriorly by arytenoid cartilage and corniculate cartilage as well. Okay, let us move now to the laryngeal cavity itself. This is a coronal section of the larynx, above or below any figure. They are the same, but I try to use like more than a figure. So what does it mean when you say coronal section? That means you divided the larynx into anterior half and posterior half, right? Or divided anterior part and posterior part to be like accurate, right? So you are looking to the larynx from the back. You are looking to the larynx from the back. Okay. Now, this is the laryngeal cavity, in which the laryngeal cavity extends from the laryngeal inlet from here to the lower part of the cricoid cartilage. This is cricoid cartilage, which is that marks the end of larynx. So this is the laryngeal cavity, the cavity of the larynx. Okay. Now, look at the epiglottis. This is the epiglottis. This is the what we call the vestibular ligament. Do you remember the vestibular ligaments? And the vestibular ligaments, once they covered with mucous membrane, now we can call it vestibular fold. And here below, guys, below them, you have vocal ligaments, and they are covered by mucous membrane, so we call them vocal folds. So the space, this is a laryngeal cavity, yes, the space between the, what we call it, vestibular folds, this is space between the right and left vestibular folds or ligaments, called rima vestibuli. This is this space, a narrow space called rima vestibuli. On the other hand, the space between the two vocal ligaments, or two vocal cord or vocal folds, as you, whatever, as you wish, the space between the two vocal ligaments or folds, it's called rima glottidis. Rima glottidis. And this space is the, or this region or space is the narrowest region in the laryngeal cavity. Rima glottidis is the narrowest area there in this cavity. Okay. Now, what about this? Let me change the color. What about this space between the what do we call it, vestibular folds and vocal folds? This area, it's the ventricle. It is the ventricle. We call it the ventricle, right? So let us now define the laryngeal cavity. So the area above the, let me erase this stuff, guys. So the area, guys, again this one, sorry, the area above the vestibular folds, these are vestibular folds, the area above it, this one, is called supraglottic region or vestibule region because it's the entrance. Supraglottic region. The area below the vocal folds, this area, it's called infraglottic, not supra, no, infraglottic. Now the area between the vestibular folds and vocal folds called ventricle, right? And the ventricle has what we call it upward invagination called saccule. Let me show you here in the next figure. Look, this is the ventricle, and look at the shadow here, goes anterior and up. This is the continuation of the ventricle, what we call it the laryngeal saccule, that contains goblet cells to secrete like a mucus to lubricate the vocal cords, because they are always like moving and frict against each other, right? Abduction, adduction, tension, tension. So you need to be lubricated. Okay, let me invest this this figure and again iterate what I mentioned earlier. Do you remember, guys, the epiglottic membrane and the lower end form vestibular fold? Here is, guys, the vestibular ligament covered by mucous membrane. We call it vestibular fold. And you remember the cricothyroid ligament or conus elasticus, in which its upper end is free and form vocal ligament or vocal fold, right? Vocal ligaments or vocal fold. Look at the space between the vestibular fold and vocal fold. This is, of course, above. The vestibular fold above, vocal folds below. This is the ventricle. This is the ventricle, right? And goes up as a saccule, right? Okay. Now, again, here is just, we will iterate what we mentioned earlier. Again, you see here is the thyroid cartilage, guys, and this is a cricoid cartilage that articulates superiorly with the arytenoid. Look at the vocal process of arytenoid. They attach to the vocal cords or vocal ligaments, and the vocal ligaments approximate each other and attached in the thyroid, posterior surface of thyroid cartilage anteriorly. So, for example, look how they are adducted to each other when you want to, for example, speech. But sometimes they are, or most of the time when are briefing like normally, they are abducted from each other in order to permit the air to get into the larynx and laryngeal cavity and move to the trachea and lungs ultimately, right? So again, let me I think we said that the space between the vestibular folds above here, sorry, they called rima vestibuli, but the space between the vocal ligaments or vocal fold or true vocal cord, we call it rima glottidis, okay? And I would remind you here, guys, and I have to say that, and I would prefer to use a previous figure. Here, for example, you see the vestibular ligaments and vestibular fold. They have, yes, they are vestibular ligament, but they have nothing to do with the sound. They don't produce voice. They don't produce voice. That's why we call them here. Let me raise this. Look here, guys. These are the vestibular ligaments covered by mucous membrane. That's why I call it vestibular folds. They have nothing to do with the voice. They don't produce voice. That's why we call them either vestibular folds or false vocal cords. الأحبال الصوتية الكاذبة. While inferiorly you have the vocal ligament or vocal folds, and we call them true vocal cords. الأحبال الصوتية الصادقة that produces, guys, or they produce, sorry, the voice, right? Okay. What else? Yes, during the laryngoscope, in case, for example, you want to insert endotracheal tube, you will see this view using laryngoscope. This is the epiglottis anteriorly. These are, what you see here, the white color, kind of a white color, will be the true vocal cords, the white color, true vocal cords. That means you are in the larynx, not in the esophagus. You have to get in with the endotracheal tube, right? Okay. Um, I think lastly, you know, guys, that the laryngeal cavity lined with ciliated columnar epithelium, which is the respiratory mucosa, except the surface of vocal cords, true vocal cords. Why? Because of their exposure to continuous trauma during phonation and speech and so forth, we need like an epithelium that you know, can compensate the friction and trauma, and should be, I would say, the strongest epithelium, which is the stratified squamous epithelium, which is about 30 layers, right? And of course, it contains many mucous glands. The mucous gland numerous nearby the saccule in order to lubricate the vocal folds, as I mentioned earlier. Okay, so guys, let us now move to the laryngeal muscles, and I would recommend to divide the muscles of the larynx into two groups: the extrinsic muscles and intrinsic muscles. Simply, the extrinsic muscles, those outside, they control the movement of the larynx up or down. That means these muscles, either they elevate or depress the larynx. That's it. While the intrinsic muscles, they control the larynx or the function of the larynx itself. For example, when you remember that the larynx is an organ for passage airway, that means we need muscles to control the laryngeal inlet. Also, you know that the larynx is an organ for voice production. That means I need muscles to control the movement of vocal cords. Simply. So the extrinsic muscles, I'm not going to talk too much about them because they will be covered in head and neck in the next semester. But mainly these muscles, or the extrinsic muscles, usually either they elevate the larynx up or depress the larynx below. So the muscles that elevate the larynx, usually they are suprahyoid muscles. They are located above the level of hyoid bone. This is the hyoid bone. These muscles above that level. So when they contracted, they pull the hyoid bone up. And we know that the hyoid bone connected to the larynx. So the larynx will go up. On the other hand, there is a muscles below the hyoid bone and connected inferiorly, for example, to the sternum and so forth. So when they contracted, they pull the larynx below. Let's start with the suprahyoid muscles, and you see here, guys, the mylohyoid muscle, and deep to it you will get geniohyoid, and you have the anterior pili of the gastric and the stylohyoid muscle. So mylohyoid and geniohyoid, stylohyoid, anterior pili of digastric, that's indirectly connected to hyoid bone by this trochlea. Okay, now what about the infrahyoid? Still here, guys, you can go back to the lecture of the pharynx on soft palate and watch and get more details about these muscles, but these are longitudinal muscles of the pharynx, not shown here in this figure. They elevate the larynx, like stylopharyngeus, salpingopharyngeus, palatopharyngeus. On the other hand, guys, you have muscles, extrinsic muscles, that depress the larynx. We call them the infrahyoid muscles. From medial to lateral, here you have the sternohyoid attached to the sternum and hyoid, and you have the omohyoid laterally. If you remove them, you will get this muscle, which is sternothyroid. All of these three muscles depresses the larynx. Somebody can say it's not written here, but this muscle really interesting, the thyro, attached to thyroid cartilage, thyrohyoid. It has dual function, and it depends on what the function, what the situation. Sometimes it elevates the larynx, sometimes it depresses the larynx. That was about the extrinsic muscle. But here is the most important muscles, guys. Muscles the intrinsic muscles. And we said the intrinsic muscles, we are going to divide them into muscles controlling the laryngeal inlet. This is the laryngeal inlet. We talked about it previously in this lecture. This is the laryngeal inlet. We need some time to narrow the laryngeal inlet. If, for example, if you think about like carrying a heavy object or whatever. So what do you think the muscle that has this ability? Indeed, simply the oblique arytenoid muscle. Again, let me remind you that this is hyoid bone. This is epiglottis. This is a cricoid cartilage. This is a cricoid cartilage. And here you have arytenoid cartilage. So these muscles attached to the muscular process of arytenoid, and passes attached to the apex of the adjacent arytenoid cartilage. Then they pass up along the aryepiglottic fold. That's why we call them oblique arytenoid muscles. Oblique arytenoid muscle. So this is the oblique arytenoid muscle that extended up. This extension around the, let's say, the aryepiglottic fold, we call them aryepiglottic muscle. You can say it's part of oblique arytenoid. So at the end of the day, guys, the muscle that controls the laryngeal inlet is the oblique, let me erase it, oblique arytenoid muscle. This one, oblique arytenoid muscle, extended up as aryepiglottic muscle, right? Oblique arytenoid continues up as aryepiglottic muscles. So when they contracted, you imagine they will narrow this inlet, right? That was about muscle controlling laryngeal inlet. Now, what about the muscles acting on vocal cord? Yes, what do you expect from the vocal cord? What the expected movement for the vocal cord? Well, guys, these are the vocal cords that produce the voice. They can abduct it like this figure. They can abduct it, or they can adduct it, or other than the abduction and adduction, can be tensed or relaxed. What else? Nothing. So for the abduction, we need in quiet respiration, if you or forced inspiration. You're going to take a breath, or during the quiet respiration while you are breathing, while sitting with the chair and so forth, your vocal cord should be abducted, ABD, abducted, right? And in this case, you have just one muscle, which is the posterior cricoarytenoid muscle. If you remember, I said this is cricoid cartilage. So this is posterior crico, because from a cricoid process, posterior cricoarytenoid. It attached to the muscular process here of arytenoid cartilage. So when they contracted, they pull the arytenoid laterally, like this case. You see the muscular process. So when they contracted, they pull these arytenoid cartilage laterally. And in this case, once you know, my friend, that the vocal ligaments attached to vocal process here and here of arytenoid and anteriorly to thyroid, you expect they will abduct. Right? So it's the only abductor muscle. And this is the problem during the nerve injury, right? So you have the posterior cricoarytenoid. It's for abduction, the only abductor. Now, what about the muscles that adduct the vocal cord, approximate them to each other? Well, indeed, they are not the posterior cricoarytenoid. No, they are the muscles starting with the lateral cricoarytenoid, not posterior cricoarytenoid. No, lateral. Look at it here. Not posterior. No, it's lateral crico attached to the arch, or the upper part of the arch of the cricoid, and inserted in the muscular process. So once they contracted from here, and contracted from here, they approximate the arytenoid and ultimately the vocal cords to each other. So they are the main adductor with the help, of course, with the help of transverse arytenoid. That means there is a muscle between arytenoid here, transverse arytenoid, and oblique arytenoid. When they contract, they approximate the arytenoid cartilage to each other. So these are mainly the lateral cricoarytenoid with the help of transverse and oblique. They are adductor of vocal cord. So we finish, guys. The abductor, which is the posterior cricoarytenoid, and the adductor, which is the lateral cricoarytenoid, non-posterior, with the help of transverse and oblique arytenoid. Look, we are working on arytenoid because the vocal cords attached to arytenoid cartilage, guys, right? Okay, that was abduction and adduction, right? Now, what about stretching? Why we need to tense or stretch the vocal cord? Why? Because in case you need to create a sharp, loud voice, right? If you raise your voice up with a sharp, loud voice, you need to stretch the vocal cord. And in this case, how can I stretch my vocal cord? Let us get back here. You know that the vocal cords, what's this? These are arytenoid cartilages attached to vocal cords, and the vocal cords attach anteriorly to the thyroid cartilage. They attach to thyroid cartilage, and below it you have the cricoid. How can I tense the vocal cord? How can I stretch them? Just push the thyroid cartilage down. How can I push it? It should be a muscle between the cricoid and thyroid. Once they contracted, the thyroid will move down, right? And by this way, it will be stretched. And in this case, this is the thyroid, and this is the cricoid, and there is a muscle here anteriorly. What do we call it? Cricothyroid. Cricothyroid muscle. Once contracted, it pulls the thyroid cartilage down, and by this way, the vocal cords here inside will become like tight, and they will be stretched, right? So they attach to the here the lateral aspect of thyroid of the cricoid arch and inserted in the inferior horn or the lower part of the lamina of thyroid cartilage. Most importantly, stretching the vocal cord is cricothyroid muscle. That's it, anteriorly. Remember this muscle, cricothyroid. It's the only muscle innervated not by recurrent laryngeal nerve. It's innervated by external laryngeal nerve. The only muscle, the only intrinsic muscle that's innervated by external laryngeal nerve, not recurrent laryngeal nerve, okay? Keep it in your mind. Okay, now that was the muscle, cricothyroid muscle for stretching. What about relaxing the vocal cord if we want to change the tune of the voice, right? So simply let us remember again where we have the vocal cords, where they attached. Again and again, the vocal cords attached to arytenoid cartilage by vocal process and to thyroid. That means if I want to relax these cords, I need a muscle to span the area between thyroid and arytenoid. Thyroid and arytenoid. Once it's contracted, it pulls the thyroid and arytenoid close to each other. That means the vocal cord will relax. So what would be the muscle? The muscle would be here between the arytenoid cartilage and thyroid, called thyroarytenoid muscle. Thyroarytenoid muscle. Very simple, right? Let me erase it and show you this is the thyroarytenoid muscle, and the lower border or the lower part of the thyroarytenoid muscle is the vocalis muscle. You see the vocalis muscle? This is the vocalis muscle, guys, in which once they contracted, they relax the vocal cord. Now, what about the nerve supply? So simply the nerve supply, guys, for the larynx, we have a motor supply to the muscles, and we have a nerve, or nerves carry the sensations from the larynx itself. Okay, let us summarize it in this way. You remember, and already we mentioned all intrinsic muscles, controlling laryngeal inlet, controlling the vocal cord, and so forth. All the intrinsic muscles of larynx are supplied by recurrent laryngeal nerve. Somebody can say, from where recurrent laryngeal nerve? We have a vagus nerve, cranial nerve number 10 on the right and on the left. So the vagus nerve here gives a superior laryngeal nerve. Remember this, superior laryngeal nerve. Then the left vagus goes down and the right vagus goes up to the subclavian, right subclavian artery. Then the right vagus will turns, or it gives a branch that returned back called right recurrent laryngeal nerve, and the left goes down to the mediastinum, and it gives the right the left vagus gives here the left recurrent laryngeal nerve that ascends, more very important, ascends between the trachea and esophagus. This is the trachea behind the esophagus. So these recurrent laryngeal nerves ascend between trachea and esophagus. They ascend back to the larynx. Okay, so these recurrent laryngeal nerve, the right and left, they innervate all intrinsic muscles of the larynx except one muscle, this one. You remember? I said remember this muscle, cricothyroid. Cricothyroid muscle, if you remember that, stretch or tense the vocal cords. This muscle, cricothyroid, innervated by, you see the superior laryngeal nerve, it gives internal laryngeal that moves inside the skull, and external laryngeal. This external laryngeal nerve innervates the cricothyroid muscle. Okay, that was the motor, I mean the muscles, right? And remember that, right? Remember that we have a vagus nerve that gives superior laryngeal nerve, then the superior laryngeal gives internal to the inside of the laryngeal cavity, and external laryngeal, that you see it gives the cricothyroid. That's it. But the vagus, the right and left, they give back recurrent laryngeal nerve, and the recurrent laryngeal nerves innervate all the remaining intrinsic muscles. Okay, that's motor. What about the sensory, the sensation? I would say this is the position of, you see, position of vocal folds here. Above this level, the sensations carried by the sensation from the laryngeal cavity above the level of vocal fold here, carried by internal laryngeal nerve, this nerve. While all sensations below this level from the larynx carried by, again, recurrent laryngeal nerves, right? Simply, the arterial supply for the larynx, usually look at the blood supply. This is the larynx. Here is the larynx also above. This is the level of vocal cord. Above this level, the blood supply comes from the artery called superior laryngeal artery. This is the superior laryngeal artery. And below this level, you have inferior laryngeal artery, right? And the superior laryngeal artery comes from superior thyroid artery. The inferior laryngeal artery comes from inferior thyroid artery. So the thyroid artery, the superior and inferior, they give two branches. Each one give superior and inferior correspondingly, respectively. The superior and inferior laryngeal arteries, right? But the superior thyroid artery comes from external carotid artery, while the inferior thyroid artery that gives the inferior laryngeal artery, it comes from thyrocervical trunk that comes from the first part of subclavian artery. Anyway, venous drainage follow the same. You have superior and inferior thyroid vein, right? Sorry, here. superior, because here is the superior laryngeal vein and here is the inferior laryngeal vein. The superior laryngeal vein, it drains into superior thyroid vein, and that one in the inferior thyroid vein. The superior thyroid vein drains into internal jugular, while the inferior thyroid vein, it drains into mainly left brachiocephalic. Sometime also in the junction between the internal jugular and right subclavian, right? Okay, that was about the blood supply, and he just remind you once you want to speak, the vocal cords should adducted to each other. How? Listen, try to say hi or try to say anything while you are gasping a breath or during the inspiration. Try to take a breath and speak while you are taking a breath. You cannot, but you have to take a breath, then you have to adduct the vocal cords, then start to speak, right? Okay, that's during the quiet respiration, while like you sit down in the chair and whatever, you sit in the front of the screen. So during the respiration, quiet respiration, your vocal cords are abducted away from each other to get the air there, right? But while you are swallowing, the epiglottis tilted down and the larynx goes up to close the laryngeal inlet, right? Now, look at this view here. This is forced inspiration, that you want to take really a deep breath. You want to take a deep breath, right? So the vocal folds abducted and the vestibule open and the epiglottis tilted anteriorly. So it's patent and open. Look at it here. Vocal cords away from each other. You see the laryngoscope here, the view from laryngoscope. Excellent. But if you want some example, this is called effort closure. If you want to carry heavy load or heavy table or chair or whatever, you want to take a breath and keep it inside your lung to push the diaphragm down. And by this way, when you push the diaphragm down, you are increasing the intra-abdominal pressure. So then you can carry stuff like when you say, I think you used to use this like when you want to carry something, right? So this maneuver even called Valsalva maneuver. Valsalva maneuver. This is in case will decrease the heart rate, right? Those come into the emergency with the tachycardia. So they use this maneuver to take a breath and keep it like inside. And in this case, you are closing the vocal cords and vestibular folds above it, right? Like this case, you are closing it to make sure that the breath or the air kept inside. So already, guys, we covered the intrinsic muscles of the larynx and the innervation for those muscles. Now, but what about the injury for those nerves? You know, guys, let me just quickly remind you with the muscles of the larynx that all muscles of the larynx, all intrinsic muscles, I mean, of the larynx, innervated by recurrent laryngeal nerves, except the cricothyroid muscle, in which I showed you before a couple of minutes. The cricothyroid muscle that tense the vocal cord. This muscle is the only muscle that's innervated not by recurrent laryngeal nerve, but by the external laryngeal nerve. So all the intrinsic muscles of the larynx covered by recurrent laryngeal nerves, except the cricothyroid muscle, in which it innervated by external laryngeal nerve. Let me show you back here here, guys, the intrinsic muscles, and here you see the superior laryngeal nerve that gives internal laryngeal nerve and external laryngeal nerve. So the external laryngeal nerve is the nerve that innervates the cricothyroid muscle. You see here the cricothyroid, while the rest of the intrinsic muscle of the larynx innervated by a recurrent laryngeal nerve, because these nerves, guys, in very close relation to the blood vessels supplying the thyroid gland. So sometime during the thyroidectomy or parathyroidectomy sometime, these muscles are vulnerable for injury. That's why we are talking about the lesions of the laryngeal nerve. Let us start first with the external laryngeal nerve, the nerve that innervates, that I showed you, innervate the cricothyroid muscle. So in case, for example, you get like bilateral external laryngeal nerve palsy. That means, anyway, this is anterior, right? And this is posteriorly, and these are the vocal cords. These are vocal cords. So, say for example, the right and left external laryngeal nerves got like injured or sectioned. So, what will happen? What will happen that the cricothyroid muscles will be paralyzed, and you know this muscle is responsible, is the only muscle that's innervated by external laryngeal nerve, and it's the muscle that tense the vocal cord. And in this case, when they are paralyzed, that means you will get a flaccid vocal cord, and the result is weakness of the voice. Weakness of the voice, because you know, if you want to create like sharp, loud voice, you have to use the cricothyroid muscle and tense the vocal cord. But in this case, now when the vocal cord becomes like flaccid, you get weakness in the voice. Okay, that was about the external laryngeal nerve. Now what about the other nerves innervating the larynx? Well, indeed, you have just here the recurrent laryngeal nerve. And in this case, let us start with complete section, right? Not partial section. No, here is, I'm going to talk about complete section of the recurrent laryngeal nerve, either in one side, unilateral, or bilateral. Okay, so in case there is like injury to the right recurrent laryngeal nerve, and in this case we are talking about complete section, that's complete cut for the right recurrent laryngeal nerve. In this case, of course, I will remember you that this is anteriorly, because this is the epiglottis, right? Remember the vocal cords like a triangle anteriorly here, right? Anyway, so when there is a section for the right recurrent laryngeal nerve, that means you know that the recurrent laryngeal nerve is responsible for all muscles, for all intrinsic muscles of the larynx except the cricothyroid. That means the recurrent laryngeal, let us make it like clear. The recurrent laryngeal nerve supplying the adductor and abductor muscles. Adductor and abductor muscles. And in this case, when you have a complete resection of the right recurrent laryngeal nerve, well, you expect that the vocal cord will assume a position. It's not as normally abducted here, and it's not close to midline adducted here. It's a midway in between. So the right vocal ligament will take a position midway between abduction and adduction. And in this case, let me erase it, guys. So in this case, you see, it just lies lateral to midline. Now, what about the speech? Do you think the speech will be affected? No, the speech is not greatly affected. You know why? Because the left vocal cord is still working and can compensate. And it can, for example, during the phonation or speech, the left vocal cord can compensate and move, because it's still functioning, right? Move and close the gap and adduct it, right? So speech not really affected. Okay, now say for example there is a complete section of right recurrent laryngeal nerve, and I have to draw it from here. to the left, because this is anterior, to the left and right recurrent laryngeal, both, let us say, both sectioned completely, bilateral complete section of right and left recurrent laryngeal nerves. That means when we know that the recurrent laryngeal nerves, each one controls the abduction and adduction muscles. That means there will be balance, again, similar to that case, but here is bilaterally. The vocal cords assume again a position midway between adduction and abduction. So this is the midway. Also here for this one, it will be not here and not in the midline, right? So it will be here, midway between abduction and adduction. In this case, they both assume a position between adduction and abduction because both abductor muscles and adductor muscles are paralyzed. So it's equal. And in this case, look, the space between the vocal cords, or what we call it remaglottis, kind of impaired, right? Partially closed. So breathing is impaired. So because, in quiet respiration, the vocal cords should be abducted at least like this, not like this case, right? They are, I would say, close to each other. So breathing is impaired. What about the speech? They are paralyzed. They are away from each other. They will not compensate. In this case, the intact vocal cord compensates by moving toward the paralyzed one. But in this case, both are paralyzed. They will not adducted. Right? That means the speech is lost. Right? Okay. Now, let us shift to another case in which still recurrent laryngeal nerve, unilateral and bilateral, but here is not complete section, it's a partial section. For example, this is the nerve. Sometimes it gets like a trauma during the surgery here or there, sometimes squeezed, sometimes under pressure, sometimes partially sectioned, but not completely, right? So in this case, again, you have the right recurrent laryngeal nerve got partially sectioned or got trauma or whatever. So what will happen? Before say what will happen, let me explain one thing to you. Say this is the nerve, right? This is the nerve. And it has been assumed that the fibers, the recurrent laryngeal nerve gives like adductor muscles and abductor muscle, right? It has been, say, this is adductor muscle and this is abductor muscle. So they assume that the adductor muscles, or let us say the abductor, which is easier to remember, the abductor muscle has more fibers compared to adductor muscles. That's why when the nerve partially injured, the abductor muscle will be severely affected. The abductor, ABD, the abductor muscle will be severely affected. Another assumption that the fibers that control the abductor muscle, the fibers of the nerves that controls the abductor muscle passes peripherally on the nerve. That's why when there is a trauma or pressure or partial section, the fibers of the abductor located outside, so they are more vulnerable for injury. That means the abductor muscle is affected more than the adductor, right? And if you know that, guys, how can we explain what will happen, guys? Okay, here you have the right recurrent laryngeal nerve just partially sectioned, right? Partially sectioned. So you expect that the fibers that innervate abductor muscles will be affected. That means the vocal cord will not be abducted. Who's the dominant now? The dominant is the adductor muscle, ADD. The adductor muscle, that means the vocal cord will move not midway, no, toward the midline, right? Assuming the midline position, close to midline here. Again, what about the partial section again? But here is bilaterally, the recurrent left and right recurrent laryngeal nerve, but they are indeed just again partially sectioned, not completely, partially sectioned. Again, the affected muscles here will be the abductor muscle will be affected again and again, and there is the dominant here, the functional here that will not really get mostly affected is the, or will be the adductor muscle, and that's why they will adduct the vocal cords on close to the midline. And in this case, this is really emergency case in which there is acute breathlessness, dyspnea, and the stridors will be heard there in that patient, and the patient needs directly tracheostomy, opening create an opening in the trachea or a cricothyroidotomy right away directly, because the breathing is like severely affected. So I hope by this video, guys, and here is again the cricothyroidotomy here, guys, in which this is the cricoid process, is the thyroid, cricoid cartilage and thyroid cartilage, and in between you have the cricothyroid ligament, median cricothyroid ligament. And in the emergency case, already I explained that in the lecture, you can go back, but just in hurry, in the emergency situation, there is just tiny small vessels and pyramidal lobe of the thyroid gland sometimes is there, so a safe area in emergency situation to open the cricothyroid ligament, the median cricothyroid ligament, and insert like a small tube to save the life of that person. Why we do this in emergency situation? When there is obstruction above the vocal cords or vocal folds, when there's obstruction with the foreign particles, especially kids choking for reason or another, so you want to get like an air to get in the trachea and lungs. So in emergency situation, you can open it with any sharp instrument you have, just to create a small incision and insert like a small tube there, like that use it in your pen, for example, right, and save the life of that person. Thank you, guys. This is the end of the larynx. Thank you so much.